Acute myeloid leukemia is a cancer of the myeloid line of blood cells. Acute myeloid leukemia progresses rapidly and is typically fatal within weeks or months if left untreated. Acute myeloid leukemia more common in older people and is uncommon before the age of 45, although it may occur at any age. Males are affected slightly more often than females. The 5-year survival rate is about 35% in people under 60 years old and 10% in people over 60 years old. Acute myeloid leukemia is one of the most common types of leukemia in adults. The lifetime risk of acute myeloid leukemia is 0.5% of men and women. Acute myeloid leukemia is fairly rare overall, accounting for only about 1% of all cancers. Signs and symptoms: a lack of normal white blood cell production, frequent infections, a drop in red blood cell count, anemia, fatigue, paleness, and shortness of breath. A lack of platelets can lead to easy bruising or bleeding with minor trauma. Fever, fatigue, weight loss or loss of appetite, shortness of breath. Sometimes enlargement of the spleen. Lymph node swelling is rare. Risk factors: preleukemic blood disorders, such as myelodysplastic syndrome, MDS, or myeloproliferative neoplasms. Anti-cancer chemotherapy, in particular alkylating agents. Smoking, exposure to benzene and other aromatic organic solvents. High amounts of ionizing radiation exposure can increase the risk of AML. For example, after prostate cancer, non-Hodgkin lymphoma, lung cancer, and breast cancer, thyroid cancer. But this increased risk returns to the background risk observed in the general population after 12 years. Laboratory analysis: an abnormal result on a complete blood count. Excessive abnormal white blood cells, leukocytosis. Leukemic blasts are sometimes seen. Isolated decreases in platelets, red blood cells, or even with a low white blood cell count, leukopenia. Definitive diagnosis made by bone marrow aspiration and biopsy. Mechanism: immature precursor of myeloid white blood cells. A normal myeloblast will gradually mature into a mature white blood cell. In acute myeloid leukemia, though, a single myeloblast accumulates genetic changes which freeze the cell in its immature state and prevent differentiation. Such a mutation alone does not cause leukemia. However, when such a differentiation arrest is combined with other mutations that disrupt genes controlling proliferation, the result is the uncontrolled growth of an immature clone of cells, leading to the clinical entity of acute myeloid leukemia. First-line treatment of AML consists primarily of chemotherapy. Induction and post-remission therapy. The goal of induction therapy is to achieve a complete remission by reducing the number of leukemic cells to an undetectable level. The goal of consolidation therapy is to eliminate any residual undetectable disease and achieve a cure. Hematopoietic stem cell transplantation is usually considered if induction chemotherapy fails or after a person relapses, although transplantation is also sometimes used as frontline therapy for people with high-risk disease. Acute myeloid leukemia is a curable disease. The single most important prognostic factor in AML is cytogenetics. Certain cytogenetic abnormalities are associated with very good outcomes, for example the 15:17 translocation in APL. Relapse is common, and the prognosis is poor. Long-term survival after a relapse is so rare that the only known case was submitted to the Catholic Church as evidence of a miracle attributed to Marie Marguerite de Youville.